everybody. This is a very exciting first. We are going to be talking about how powerful chiropractics are, not just for kids, but for mamas too. And we are talking with an expert in pediatric chiropractic care, Dr. Tony Ebel, and he's from PX Docs. Definitely make sure to check him out. We'll talk more about it. It's going to be in the show notes. And we're really diving into what are things that we think we know about in terms of, ADD, autism, learning disabilities, even mental health issues. We always think it's infections, toxins. We know nervous system dysregulation is a part of it. We're going to be talking about something maybe you've never heard about, and that's called birth trauma. So welcome. I'm so glad you're here. I'm so glad we're having this conversation because this is something nobody wants to talk about because they're afraid that that's the source of the problem. But the good news is there's things that we can do to support even birth trauma.
It's the most important conversation to have right in the thick of this is, and thank you for having me here. Very few people, we were chatting about it, very few people get into the nervous system with the depth that you do, tell the truth, and then just bring the hope, the empowerment, and most importantly, the actual strategies that do something to help these kids and families. So information is great, but it's useless without implementation, right? And actually strategizing.
Amen.
Yep. So I'm here to make sure that we don't just talk about the problem, but we're going to absolutely get into those proven solutions and strategies as well. But yes, birth trauma is the one thing that I always tell my patients, whether I'm in a group with a workshop or like this or one-on-one in the practice, there's a duality of emotions with this. And actually, Dr. Roseann, you could explain this better than me. I'll do my best and then you clean it up. The bad news is the good news. Okay. And so none of us, we live this way already in default as parents, the coulda, shoulda, woulda, mentality just traps us, and that's part of our healing process as well. But when you find out about what you're about to find out about, I absolutely positively am going to deliver it to you in a very empowering, exciting, thank God we now know because we can do something about it. And birth trauma is what we always refer to as the moonwalking bear, which probably shouldn't say this on the podcast because you don't have the visual, but it's this really funny YouTube video where there's just all this distraction happening and this dude in a bear suit does the moonwalk right in the middle of the video, but you don't spot it the first time you watch it. And then they kind of rewind it and go, did you see the moonwalking bear? Well, at birth is the literal busiest, craziest, transformative time for our whole families. So this trauma is happening right in front of everybody's eyes, the doctor's eyes, the parents' eyes, all of our eyes, and nobody's doing anything about it because you have to first talk about it, to know about it, to do something about it. So that's kind of an opening frame as to why this is such a well, duh, holy heck, that's true conversation. I mean, I'll tell Uber drivers about this. So I'll get it. They'll be like, what do you do? And I'll be like, well, I specialize in brush. I can do it in like 3 minutes. And they're like, geez, yeah, so I know.
Well, nobody ever thinks about that. And
No.
let's unpack birth trauma because I think most people think about birth trauma is, the extreme cases, right? Which
Correct.
You and I both had, cord wrapped around the neck 5 times, not breathing, had to be resuscitated, APGAR of 1, all that. But there's more than that because sometimes it's, we're giving kids, mothers Pitocin and different things and birth trauma. How do these practices contribute to the possibility of birth trauma? And really, what is it?
Yeah, you got it. Well, it's a freaking pandemic of normalizing things from the medical system that aren't normal at all. So we've tried to normalize chronic illness. We've tried to normalize, a medication for everything. And so that's actually this case too, right? Which is why it all coalesces together. And it's like all of this very physically injurious issues. So forceps, vacuum, those would be the bigger versions of birth trauma, but even C-section, that is literally, and I'm just going to come right out of the gates and call a spade through this. We are literally taking a big set of human hands, placing them on the child's head and neck, the one thing they cannot control on their own. When the baby comes out, let's say it all goes good and there's no intervention and I would say it this way, you hand said baby to your brother or nephew who's never held a baby or anybody, you're like, hold the head, hold the neck, because they can't physically protect themselves. And so we grab a hold of that, yank and twist and pull them into the world. And induction, Pitocin, these are all things that are there. And so what the medical system has done, because intervention is very financially important to the bottom line of the medical system. The doctors who work there, the hospitals who, that increases your stay from a day to many days. It's just true. And I know, none of this is that first part. Like, these aren't the fun parts of the story because they're exposing the truth to it, but that's exactly what it is. And so there's so much intervention and they've normalized it. So like in my workshop, I show another video where it's a C-section, very standard C-section, not even emergent. And the doctors are just whistling and joking while they literally physically yank this baby by their head and neck into the world. And so it's just been completely missed over because they've normalized it medically. And then you got to look at it from a, oh gosh, I just lost the word, not compliance, but malpractice standpoint as well. So
and
the
that's
line in
so,
the sand,
so true.
yeah, if it's not severe, and they even have a one of my best friends, it's wild how God puts your families together. One of my son's best friend's dad, he's now my best friend. I love this dude. He's actually a defense attorney for OBGYNs. And it's wild. So these conversations, so I know their story, right? And I've been on these cases and he'll actually consult me and I'm like, you get out of here. I'm not going to help you. And anyways, but so they also have that. If they really let in what birth trauma really was and how kind of, let's call
it the
long-term
effects.
Yeah. And how low the bar of the intervention actually needs to be to have significant long-term effects. Well, that would really change the medical system, right?
Yeah.
Just like a whole lot of other things,
and
the
Tony,
world is finding out. We're talking
Dr.
about.
Tony, you and I both have had many cases where they do have a low APGAR or they're had a broken clavicle or, battered and bruised. And yet I maybe one time in 3 decades had a parent tell me they were warned there were going to be problems, right? Now, obviously we already know this, that it's because they're afraid of liability of that. But, I think that's what's shocking to parents. Like when you and I talk about birth trauma with our people, they're like, but the doctor didn't tell me that.
Yes.
And I have to re-explain the whole thing we just
People
talked
say it all
about.
the time. The most common thing I get back is, oh my gosh, how come nobody, and when they say nobody, they mean, how come my doctor didn't tell me that, right? How come the OB didn't tell me that? How come the pediatrician? And then the crazy thing is, and then this problem gets worse because the actual, like the most overlooked cause of all these conditions is this physical birth trauma to the brainstem. And we'll get more into the science and everything behind it after we get into what is the trigger of it. But the pediatrician was literally not there. They weren't in the room. Like when you actually watch birth happen and you see what happens to our babies and parents, if this has gone through you, and again, I know we have you here and we're going to get you to where the empowerment and the solutions come. But like, if you just think about why do they put a curtain up for a C-section? It's not just the incision. It's they don't want you to see what they're doing to your baby's head and neck. So we can talk about this. I have all the research, all the science, but if anyone were to just see it, you would know it.
Yeah.
Then you would know it. And so how they can see it and not say anything about it is literally entirely CYA. They are literally covering their tracks because they already, OBs and pediatricians already have the highest malpractice because they cause the most amount of damage. Just call a spade again on that.
Yeah.
And so if this were to change too, which it will change, I do trust God will change this world to the place where it's like, hey, because here's the truth within the truth. Sometimes, like in our cases, right? Sometimes these interventions have to happen. And sometimes you literally you could take every freaking Bradley hypnobirthing. I always tell people you could plan to have your baby in a tub at home, incense burning, Bob Marley playing, a doula in a free flowing flower pattern dress, because that's what they all wear, to it. And it could go great. And then it can't. And so what we deserve to know as parents, as whatever caused it, whether it's the medical takeover of birth or it saved mom and baby's life, it still is going to alter life neurologically and neurodevelopmentally. And I didn't know this from school. School didn't teach it to me. Actually, even my postdoctorate stuff didn't teach it. You know who taught it to me? I haven't even told you this, Roseann. Mom's taught it to me. I am trained chiropractor. We are obsessed about root cause. So when we dig in, I always say it's the toddler test. Like we just keep asking why, like reflux. Oh, reflux causes colic. Well, what causes reflux? Like you just got to keep going. I did that with autism and ADHD and anxiety and sensory. And I was told in my traditional training, oh, it's genetics. Didn't find it. My undergrad degree is molecular biology and genetics. So I know genetics very well. Never mass out. Never, ever, ever. Okay. Rarely ever mass out.
You don't
right?
have a clear genetic pathway to
No.
neurodivergence.
And then I was
mean,
told, and then what we're all told too, and parents want you to really hear this one is, oh, it's toxins, right? Whether injected. Well, guess what? These kids were already in trouble. So I'm taking these case histories with moms. And I had a great mentor who literally, as you can now tell, because I'm still talking, he would always tell me, Dr. Cody would say, Dr. Tony, if you want to find the real root cause of why these kids are sick, you need to shut up. He would always emphasize that, Roseann. You need to shut up and listen to these moms when you take the case history. Don't just go through the motions like most doctors do with case history. Actually look for the clues. And so my first year, 2 years, 3 years of practice, 85, 90, 95% now today of the time, birth trauma, one of these interventions would show up. And it was the leading trigger by far, more so than, genetic issues or microbiome issues or adverse reactions. This was the thing that in my practice showed up almost 100% of the time. So that's what was my spark to go do the research and put it all together and go, damn, that's what's missing.
So, once this happens, then we move into nervous system dysregulation.
Yes,
The gut microbiome goes off. You start triggering a lot of different things, and it is the saying that when a birth happens and everything works well is a miracle is really a truth.
It is.
Because it's very easy in today and the way things are, and every country does birth so differently. It's very fascinating. Like I've had mothers come to me and say, well, I had this baby in this country and the doctors don't like to wait, so they use forceps.
Yep.
I'm like, what do you mean they don't like to wait?
And it's just normal.
Like, yeah, it's normal, and I'm seeing them, and you literally at times in doing a q-EEG brain map, sometimes you literally can see the forceps, the spots where the forceps were on the brain.
When we palpate and do our cranial checks, you can still feel it.
Yeah. So what happens to the neck and spine? What happens to the base of the brain when they are even in a C-section, which so many babies are C-sections?
Yeah. Many hospitals are 40 to 50%. Singapore in certain countries literally are striving for 100% C-section because they think it's safer, right?
Wow.
It's wild. It's the most antiquated upside down science ever. So here's what happens. So this is why we call it the perfect storm. So there is, and again, I love that we're going right in it because this is the one nobody else is talking about. So the other factor that's in there is a lot of stress from mom's nervous system during the fertility and the pregnancy journey. And that umbilical cord, as I always like to teach it very simply, that umbilical cord doesn't just deliver oxygens and nutrients. It's the electrical neurological connection to the babies. And this is what's called the sensitive critical period of development is in utero fetal development. Birth is the most influential experience we'll ever have in life by far, because we're the most plastic. Our brain and nervous system are the most plastic. And then we remain plastic, by the way, for life, which is why healing can happen. I started getting adjusted after birth trauma and I was 21 years old when I got my first. So I never slept, had ADHD challenges, sensory issues, and it all got better. So trust me, healing can happen, even though I'm going to go isolate on these sensitive periods. And so birth trauma and these stressors, then the physical injury to the brainstem, what it does is it creates what's called the perfect storm. Within the perfect storm, which means it's a vicious cycle. Once it starts to spin, it gets a hold of the gut, it gets a hold of the immune system. But the system it actually wreaks havoc on first, Roseann, is the sensory motor system. So our brainstem, cerebellum, the brainstem, upper cervical, vagus nerve, the very first thing to develop for our babies in sequence, and it needs to develop. It's not even about being on time. People have duped us about milestones. It's not so much that they have to fit this freaking calendar in the pediatrician's office. That calendar is more detrimental than helpful because it scares parents, right? And instead it helps understand and empower it. But there's a sequence to development. And the motor system, the gross motor, sensory motor system. So sensory is walking along with this the whole time. That's why every ADHD, anxiety, autism kiddo is, if you really wanted to say what's causing those issues, it's sensory issues. And so you throw off gravitational and just gross motor ability. And I'm going to get real granular just for a minute because it matters with the injury to the neck. The first thing a baby is supposed to develop in terms of motor function is to latch, swallow, and digest their food. And then within a few weeks to few months, hold up their head and neck, control their eyes. And so it's really, to just be chiropractic-y here, it's really the neck and the skull. That is the most important thing to develop from a motor standpoint. Then there's tummy time, then there's rollover, then there's sit up, then there's crawl, then there's furniture cruise, then there's walking, then there's running. So what happens is we don't only miss the birth trauma thing, Roseann, our kids' motor development is significantly altered by this upper cervical misalignment, dysfunction, dysregulation. And if that is still there under the hood, you can, I'm cart before the horse here, but you can do perfect diet. You can add all the supplements. You can live this wonderful lifestyle. But if your child upper cervical and neurospinal system is subluxated, it is then dysregulated and it is dysautonomic, meaning sympathetic dominant, fat, gas pedal stuck on. And the downstream effects of that show up in the motor system first, the sensory system. I consider those one system actually. So the sensory motor system, then it shuts down the gut. So now they can't poop. So they're refluxy, constipated, eczema. It shuts down drainage of the lymphatics and it creates a pro-inflammatory state due to the sympathetic dominance. So now our kids are sick all the time. They can't get toxins out, whether they were ingested, injected, or inhaled. And then they get antibiotics and the perfect storm. That was a very rapid run through it.
No, I mean, and people make sure you replay it and get to hear that and take your notes. And, I think really, like, you give the analogy of a perfect storm, but it really is a domino that starts happening. And I think so many of the people you and I work with, and they fly out to work with us, is that they are stuck. They've done this. They work with the best person in this. And they did that. They did that, and really, you do have to get to that root cause. You also, I want to go back for a second because you said something that I think is super important that I don't want to miss, and how important the birth environment is. And even to take one step back further, I think some of the most dramatic, there are many dramatic things I've seen in 3 decades of working with kids and families and mothers, but also, in terms of, it seems like everybody's dysregulated. The amount of autism is just through the roof. No, we're not getting better at diagnosing it. There are a lot more autistics people.
Yeah.
But there's also a real fertility issue happening in the world.
Massive.
And
it's neurological. It's not just nutritional. It's not genetic and it's not just nutritional. It is neurological dysregulation causing those issues.
Definitely. Stress. I mean, there are so many stressed women and, and young women are experiencing fertility issues.
And they were stressed kids because the perfect storm of birth trauma has been going on for 2 to 3 generations.
And we don't want you to feel bad. This is about information. We're not trying to guilt you. I got wired uniquely, kids. It's information. All of these things are things that can be changed, right? That's the part of this conversation. We're going to dive into that. So kids, those are the signs. Let's talk about some of those. You indicated some of the signs that we see in very young children, right? Having difficulty latching, eye movement, holding their head up. And then just different delays within the motor. Can you give us some of those signs that people may not connect?
Yeah.
Just like you're talking about, because I think that's really important, because that everyone's probably listening, going or watching and thinking, holy cow, I had a C-section. Oh my God, my kid got stuck in the birth canal, right?
Yep.
It's not always A, B, C.
It's not.
It's not.
That's the hardest part of my job is, in these concepts, and same with our podcasts and the articles, like you gotta kind of take what you see clinically and in the research and kind of got to aggregate it together to create the most common, what we call pattern. And there's a very common pattern of the perfect storm, hence the, teaching it this way. But each kid definitely, and this is how, just like you take care of your kiddos, we take care of such a customized, personalized approach. Like I'm going into this, but when we sit down with the mom, we go into that child's case history. We go into their red flags and their signs. So there's 2 ways to find out for sure if your child's, well, there's a third, which we'll get to with the technology, but on your own, you can do it this way. You don't have to get into an office to do this. So the 2 things you can go through is you go through your own case history. And if there was a lot of stress, and it doesn't have to be like, same with medicine, how they kind of normalize birth trauma. Well, unless you're like high risk, like these real, working, going to school, the loss of your parent, there's serious trauma that happens to the emotional system. So the fertility and the pregnancy, I kind of lump that
Even the
into
stress
one.
of having infertility issues and then getting pregnant is very stressful. The whole thing.
Or just going to the freaking OB and nobody celebrates being pregnant anymore. It's like a diagnosable condition where you have to like, you know what? We were going to do one ultrasound at 21 weeks, but you know what? We're going to strap this Android 60G phone onto your belly and live stream and scare the shit out of you the whole time. Like I may seem like I'm being embellished. I'm not. That is the system. It's all fear and anxiety.
They say such crazy things too, Tony. When I went in with my hat before I went in to have a second baby, the doctor said to me, she wasn't my regular doctor. She said, you're 38. You're going to probably have fertility problems. I go, my name is Dr. Roseann Capanna-Hodge. Why would you talk to me or anybody like that? Of course, I got pregnant in 10 days, Tony. But I was doing all my nervous system calming and all my stuff and, whatever. I mean, age isn't the biggest determining factor anymore.
Neurological health. Let's take this thing and we'll put it all the way out into the not so distant future. We're going to figure out that nervous system regulation, HRV, nervous system health is going to be the thing that is finally going to end these freaking pandemics.
Absolutely. And people are, Tony, people are catching on.
They are
in our work.
They're getting there. They're getting there. They got their, they got Dixie, the cold plunge, the sauna, the walking in nature. It's fantastic. And I am the happiest person on earth, probably tied with you, that people are actually getting there.
Yeah. And there's many routes. Yeah. That's what this conversation is, right? There's many routes to regulate the nervous system. We got to do behavioral work too to change our behavioral patterns, right? So what are some of the signs? Yeah.
The signs are so you got case history, and then I hate to get this because I'm a natural health root cause doctor, so we don't diagnose, but these are terms people know. So I can't help you if I use language you don't understand. So colic is not something a baby grows out of. Constipation is not something a baby grows out of. And Miralax, you want behavior issues? Goodness gracious, Miralax is nasty, right? Antibiotics. So chronic ear infections, that's not something kids grow out of. But that's what the pediatrician tells these and parents, you've done it right. You've been kicking ass. We're teaching you the stuff you already knew innately in your gut. Like, that was stressful. That was a tough birth. The colic they're screaming all the time. They're constipated all the time. They can't latch. They can't swallow. Their skin's a mess. They're constipated. Another antibiotic? Come on. Like, you already in your gut, which is the number one. You want to talk about all the research I've studied, and Roseann, I know you read it all the time too. I've never met anything more accurate, and it's not even close, than mom and dad gut. And I'm going to give mom more points than anybody else because you're just connected to the baby in these ways, right? So that mom gut, something's wrong. This isn't actually normal. And I know you go into those offices and keep doing it, by the way, and ask those questions. And if they can't explain it, like Dr. Roseann and I can, you need a new doctor. Like, legit. That's the number one action step I can give you, is get rid of the people.
And you know what, Tony? I'm going to interject. And don't ask an allopathic doctor about integrative treatments. They have no training on it.
Well, I was going to say, do ask and then record it and send it to me because it's funny to watch them try and answer it. Okay, that was rude.
So many funny things.
We just talked about how me being a Midwesterner, how nice I am. And I'm not being very nice right now. I need to go back to my nice. But
I love that you're talking about trusting their gut, because these are, intelligent people. And you're like, wait, that doesn't really add up, right?
And so you got colic, constipation, chronic ear infections. Those are actually, so it may sound like, oh, well, isn't that a gut issue and an immune system issue? Nervous system controls them both, right? So it's a nervous system issue. And so they're going to grow into neurosensory problems. So you'll have sensory transition problems, sleep challenges, meltdowns, tantrums. And what are they going to say to you then? Oh, they're just 2, they're just 3, they're just a boy. It's totally normal. And then those motor delays, sensory issues, become speech challenges, become social, emotional, and behavioral dysregulation challenges. So it does involve the gut. It does involve the immune system and inflammation. It does involve the motor system. And so the 4 main systems, like probably our most helpful thing and I'll send it to you guys, you can put in the show notes. Like, we have this really simple pyramid, right? And triangle of development. And it actually starts with the tone and regulatory function of the nervous system. The next most important system is the motor and sensory system. So muscles and how the body moves, because the brain is plugged into the body. And you all felt this, if you're stuck at your desk all day and you can't move, or you're on a long flight and it gets delayed, you're cranky, you're emotionally dysregulated, your brain doesn't work well. So movement is life, which is why the one missing profession intervention, chiropractic, which is rooted in neuromuscular movement, proprioception, subluxation, that's the trigger of dysregulation. And that's what screws up the gut and the inflammatory cascade is nervous system dysregulation. And no supplement touches that. No diet change. You can stop the storm from continuing to be fed. But in these cases, we got to go into the nervous system and we've got to make these adjustments and these healing interventions to actually get that repair and reorganization to happen at a very under the hood foundational nervous system regulation level.
I want you to know that my kids were adjusted in the hospital.
Ah, heck yeah. The old Uncle Tony, where your chiropractor sneaks in and pretends to be part of the family.
Absolutely. Dr. Mara came in and did a little adjustment. And,
love.
and I love that you're saying it's never too late. I mean, I work with people that are in their 80s, and it's never too late. It's just a whole lot easier when you address things. So, if you're a parent,
neuroplasticity. Yep.
Yeah, it's about neuroplasticity and the cascade, right?
Yep.
What you're talking about is a cascade. And you mentioned skin issues, and you also talked about Miralax and constipation. I feel like ear infections, constipation, skin issues, including eczema, are like the standard. I'm in like Christian Crunchy Mama's Facebook group, and there is literally every day a post about their kids' eczema. And I'm like, and they try things, and it's like, they know it's not normal, right? And they often have all of these issues, right? And that's part of why they join these groups, right?
Sure.
But I think doing it yourself is helpful in a lot of things, but you've got a kid who's already starting to show those developmental lags, motor wise, emotional wise, social wise. You got to get professional help, because as soon as you can intervene, the quicker the relief happens. And I know that feels hard for people, but it really is the fastest path.
So the gut stuff, the skin stuff, and the ear infection stuff, I'm glad you're pulling that out, because I think I goof up and don't talk about that quite as clearly and as often as I probably should, because those are all the precursors to neurological problems, because they actually are signs of neurological problems. And even in the holistic natural space, nobody talks about this. You and maybe you and I, right, are having this chat.
Epidemic answers talk. I mean, those are soft signs of neurological issues. Those are brewing. I mean, when I'm doing these thousands of intakes I've done over the years, this is what you see as a standard in people's history.
Colic,
it doesn't mean if your kid has eczema, they're going to have autism.
No,
it doesn't.
No,
but we know that kids with autism, right? Even the American Academy of Pediatrics finally, took them a dozen years to update their stuff. And now it's been 5 years and they haven't done anything, but they recognize they have gastrointestinal issues. Constipation is part of that. And for everybody who doesn't know that Miralax is not FDA approved for people under age 18, please know that.
Neither are most of the reflux meds, right? That they give to infants with colic. So it's important to look at it, and you can actually see the role of the gut and the immune system in terms of when we start to heal. So I think here's the challenge parents and even other providers face. When you look at ADHD, anxiety, autism, seizures, it's kind of easy for parents and providers to go, oh, well, that's a brain problem, right? So that's neurological. So then there's
a med for that, Dr. Tony.
Right. I know, but let's put ourselves in the holistic, functional, integrative way.
Yeah.
Even those conditions, we look at that and we go, oh, well, that's a brain-based problem, so we're going to do these neurological things. And we kind of let constipation, eczema, and ear infections, we kind of look at that and go, well, that's a gut-only problem. So if we clean up the diet and we add in all these supplements, we go homeopathic, I cannot tell you the number of patients that come. Actually, this is the number one new patient pattern we have in today's world. And I'm all here for it, by the way, because we're moving in the right direction. My original patients, my first 5 to 10 years of practice, Roseann, they had gone all the way through the medical system, seen all the specialists and tried all the medications, right? They had no clue about birth trauma, the perfect storm, the colic, the constipation. They didn't know anything about the microbiome, gluten-free. They knew nothing of what we now know today. So awesomely, things have changed. Now, today, 80 to 90% of my patients are not yet medicated. I want to pause here, cheer and celebrate and say, moms and dads, getting out, doing your own research, you're badasses. You're doing the right things, and it's amazing because you're holding that for the last resort, whereas it used to be the first resort. And I know for many families, I'm kind of aggregating this together. But you know what I need to shine a light on? Now, 80 to 90% of my patients have already gone gluten-free, casein-free, red dye number 40 free. Their diet is perfect. They freaking bought their own goats to milk them and turn them into cheese. They literally live on a homestead. Like they are killing it with their lifestyle, and their kids' nervous systems are still a mess, and their kids are still constipated, don't sleep, and get sick all the time. Actually, our number one, right? Like the story I love the most, PJ, our AI and content writer. Like when you go to the website and you read, I have all of this written into really kick-ass articles at pxdocs.com. And PJ, literally, his kids were chronically sick. They moved from one state to another to a farm to grow their own food. They worked with Dr. Axe and all this wonderful, which is, by the way, ridiculously important stuff. They did all those changes, and those kids stayed sick, and their sensory issues stayed there until they got them adjusted because, and here's where it all comes full circle, their kids had birth trauma. They had upper cervical vagus nerve birth trauma damage. And so nutrition and supplementation is going to move you towards a healing transformation in an incredible way, because the gut, inflammation, they're all involved. But son of a gun, subluxation, birth trauma, it's the moonwalking bear that nobody knows about. And it's even holding our crunchy granola Christian Facebook group mamas back.
Well, and they're not realizing it, Dr. Tony, because
Right.
again,
And that's our fault. That's my professions. We've got to, I take responsibility for that, honestly.
But they're not telling these parents because of the litigation aspect. So, from my perspective, when I do a QEEG brain map, I can see when there's neck and back. So I don't believe, I say this all the time, like you can't go to a one-trick pony. Like I work collaboratively with people. So when I see that there, I'm like, you need to be adjusted. This is what you need to do. And that, and then you have to go back and you have to dig through and repair certain things, right? So sometimes that does the trick. A lot of times I'm dealing with people where it's years in. So I still get people that, I'm like you, I'm seeing more and more people where I'm the first stop. They're not choosing medication.
Right.
But in reality, majority of people coming to me now, we have mental health, might have started with sensory, it might have started with this, but now we have mental health issues. Now we have social issues. Now we have learning issues. I get a lot of homeschoolers because they realize their kids are too dysregulated in a public school. The sensory issues, the different requirements are just overloading them. They get better, but then they get to this point. And the other part, I think, you said but didn't say is that I think we've gotten to the point where, more than half of all kids have a physical or mental health problem, but we've sort of accepted that kids can be sort of like band-aided up, and that, you can sort of not be okay, and you have to be okay with that. Why would we not want full optimization? And I know there's a whole discussion in the world of neurodivergence. I tell everybody I'm neurodivergent, I'm math disabled, so I have I'm in there, but
I am ADHD, where the H jumps off the screen and punches you in the face.
Yeah. I mean, we didn't need, of course we know that, Dr. Tony, but when we want our kids' nervous systems and brains and bodies to be as regulated as possible, optimized. We're not saying yes, have I seen people lose their clinical diagnoses of everything? Yes. But sometimes I have kids with levels of autism or levels of ADHD, and we just improve things for them. They're more regulated. There's nothing wrong with that.
I love you. This is,
it's so
good. Sorry. Nobody else
we get excited when we're together.
I know. I feel so rude. Nobody else talks about this either, right? They're kind of either or. Like
either or.
Yeah, they're either are. And I love the sweet spot. And everybody, every one of our children deserves to have complete optimization of their nervous system function. And who knows for each kid individually how far the healing, recovery, whatever you want to call it, road that will go. Same as you,
Yes.
doctor. I have seen thousands of cases literally go from level 3 autism to like if you I'll start there. If you hung out in our clinic, so we chiropractic appointments, right? It's we're not doing as much work as other sort of people. So we will literally see about 300 to 400 people, and I have 8 doctors. So we'll see 300 to 400 people come through our clinic every single day. Majority kids, we take care of adults and their nervous systems and everything as well. But you would all day, every day, no matter what day you show up, you could sit in the community area. We don't call it a waiting room, in our community connection area. And kids will come up to you and they will chat you up, and they will be very social and very verbal and very sweet and very actually insanely empathetic and intelligent. And you would never know they were nonverbal a year ago. That happens all the time.
Best?
It's the best. I love it. It catches my eye all the time. I'll be walking through and I'll be like, Leo's just over there chatting up a storm. And that family has no idea that Leo wouldn't even come through the front door because his sensory speech and other issues were so bad, right? Like they have no idea that we had to do an intensive a year ago. And, and then in the same breath, I have a family wellness practice. And I have I have 4 kiddos, 1 very traumatic birth, and major healing needed to happen. My 3 girls, birth was awesome, but they've all gone through their stuff, right? So anyways, and then you have optimization of this is how God made your kiddo. There is sensory quirks here. There is anxiousness here, that is, and then we are going to optimize. And the other person that I think is just our best friend in this, which is where we met and got connected, is Beth Lambert with Documenting Hope. That's what I love about that organization. They're all in for helping every kiddo, from the severe to the mild to we are here to empower your kiddo. Your child will never be diagnosed and labeled by us. I wish I could have the impact in the world I do get to do and I'm trying to do without the stupid terms of, and that's stupid. That's probably not the right way to say it either, but I would love to take the terms off.
Right?
Yeah, without the label. Yeah.
And, and I think that's the other part of this too, that I try to talk a lot about is, your kid doesn't have to have a label to need support. And your kid also can have 7 labels. Yeah. Yeah. And they might all be wrong, by the way. I see that an awful lot, but we have to have a need, right? And in this case, I'm so grateful that you're talking about early, birth trauma, because I talk about it, but I don't dive into it in the way that you do. And from that physician perspective of what happens and some of those subtle signs. And, so many kids, I meet moms are like, oh, I tried to nurse and he wouldn't, or she wouldn't latch. And, those are little windows. Those are red flags that something was amiss. Right. And so when we know there's some developmental delays, we know there's different components. What we talk about chiropractic care and how can it help in the developmental trajectory with these kids that are struggling? Because for chiropractics, I think is something people are familiar with, but they think of it as themselves as an adult. Like I went to chiropractics extra when I was pregnant because my back hurt.
Pelvis, right? Yeah. They think of it as let's start there, because I always want to meet people where they're at. So there's a physical biomechanical component to what's called subluxation, which is what we work on. Like the 3 parts of subluxation is, first, there's misalignment within the vertebrae, within the neurospinal system. Misalignment leads to fixation. Just think about it. It's super simple. Think about if you take the hinge on the doorway, whatever room, if you look at that, if you were to bend the hinge, misalignment, or change the frame, the door doesn't swing smooth, right? The door gets stiff and fixated. Well, there's the neurology. Movement is life. Something called proprioception and mechanoreception is literally the most important nutrient to the brain. And that's the best way to think of it, is what's called proprioception and this perception of movement and where we are in space, which is why developmentally the motor system gets thrown. And we all know this. Even the conventional pediatrician knows that if a child is motor delayed, they're more likely to have behavior brain-based stuff, right? Like that's even accepted in the outdated world there. So,
and actually when your kids are motor delayed early, it is one of the reasons that you're more likely to get help.
It is, because you can get into EI and get into that world. Yep. So
that's right.
So that's where chiropractic intersects this conversation. So subluxation is simultaneously a physical, biomechanical, structural problem, and it's a neurological problem. Now, the problem that has limited our impact on the world is not you, mom and dad, not Dr. Roseann, not anybody else. chiropractors have just limited themselves because guess what? Insurance companies pay for back pain, neck pain, musculoskeletal chiropractic. So what happened in the 80s and 90s is when the insurance companies might be the most to blame for how bad our healthcare system is, because you don't get paid for helping people get all the way healthy, like actual nervous system regulation, prevention, promotion, resilience building. Like that's actually where healing comes from, not just health promotion. And so chiropractors have kind of pigeonholed themselves into this black and white x-rays. So the way chiropractic helps is we get into the tone and the coordination and the regulation of the sensory motor system. And so these subluxations, especially of the upper cervical, that's where the whole body's gross motor and fine motor and sensory regulation comes from. There's a nerve in there called the vagus nerve, VAGUS. And the vagus nerve is actually a cranial nerve, meaning it comes off the brainstem. It goes down through the foramen magnum, which is this opening to where the spinal cord and now the spine picks it up. And it goes down through the cervicals, the thorax. The vagus nerve that's a Latin term for wandering. It actually is the longest sensory nerve in the body. And it goes all the way down into our gut, to our adrenals, to our heart, to our lungs. The vagus nerve we now know connects to digestion. It's always known that. It's called the rest and digest. We need to update its nickname. And Roseann, you're going to love this. The vagus nerve is the rest, digest, and regulate nerve.
I love it.
Yeah. And I've actually retrained AI. Tony. So if you're using AI, I think I'm trying to I literally have retrained Claude and ChatGPT to get the vagus nerve right and speak to it like I do. I'm not even kidding. And so, so regulation is not just digestion, heart rate, and breathing anymore, like the old school thought of the vagus nerve. It is sensory, speech, hello, autism, right? And these challenges.
Yes.
And it's social, emotional, behavioral regulation, because the vagus nerve also has sensory nerve endings that goes to the eyes and the ears, and it controls our affect and it controls our emotional response. So when subluxation sets up shop, it is physical, but here's the neurological. You end up with an excessively stimulated sympathetic system. Why does a child stem? Why does a child toe walk? Why does a child chew on things? Why does a child move all the time who's ADHD? They're trying to adjust themselves. They're literally trying to stimulate proprioception. It looks at the antithesis of calming on the outside, which is why they get labeled, diagnosed, and medicated and told to sit down and be quiet.
Yeah.
You know, chemical jackets. So they are moving
medical
to
constraint.
try and calm the sympathetics. Yeah. And then and subluxation also does this to the parasympathetics. It suppresses it. So subluxation is a son of a bee. It literally has a two-part problem neurologically: excessive hyperarousal and overstimulation of the sensory sympathetic system, and suppression and interference to the vagus nerve. So what we've done with our clinical protocols is the way we help kiddos get back on track. And this is entirely different even within chiropractic. PX docs and nervous system focused chiropractors trained by us. There's a certain amount of techniques or kind of category of techniques chiropractically that are light and gentle, and they release this stuck sympathetic tension. And that's what your kid needs first. We got to get them out of fight or flight. But the other way we get them out of fight or flight is we also know, and this is the coolest, most kick-ass stuff ever. You can see it change on our scans, EMG, thermal, and HRV, and we can see it change on 𝐘𝐸. We can see it on everything, right? Can see it change on the brain. We can also stimulate the vagus and the parasympathetic plexuses. So what we've done is we've created clinical protocols that, one, we can quantify this. So we actually have diagnostic testing, and through our scans, we can find the level and the exact location, not just quantify it, but actually locate where within the vertebral and neurospinal system these subluxations are. And then we've trained our docs to be able to care plan accordingly and adjust using a multitude of techniques. So I wanted to go granular. I know you didn't ask, but a lot of families.
I thought that was incredible, because I think what people, what's amazing is the people who regularly listen, they've heard about the vagus nerves. They're hearing about nervous system dysregulation, but you're bringing in the actual body part to it and connecting everything. I also don't want to dismiss that PX Docs trains other doctors, and you can go to pxdocs.com and you can find a provider in your area. Also.
That's important, because I think a lot of families, especially your audience, I wanted to be sure to kind of get into the weeds there today, because you're the most kick-ass holistic, get my kid better at whatever. Like, you're not worried about like, well, medical doctors and chiropractors don't get along, do we? No, we'd kick their butt. We're way healthier than they are. But the truth is, like, you might have tried chiropractic, right? But
Might have
it might
tried
have
it.
been back pain, Bob, spinal, skeletal, standard chiropractic. And this is different. And so that's my other job, is like we're chatting about before we started recording. My
Yeah.
job is to also change chiropractic and say, we need enough of us trained in these protocols, because this is what these kids need. Now, standard chiropractic for back pain, hell of a lot better than opioids and surgery, but that's not this,
No,
so.
no. So, for people, right? And I think this is, going to be a lot of new information, but for people, what advice would you give to people who feel like, wow, I'm starting to recognize potentially my child had a birth trauma, but my doctor has dismissed it. What do you
Yeah.
think is their next best step?
Find out for sure if your child is subluxated and dysregulated. So testing. I just got to go to where we got to go. And so we
Yeah.
built that network. So I actually started training chiropractors for over 10 years before I started to really get loud outside of my local area about this work, because I didn't want to have you be able to find out, hey, this could help, and then have nobody to send you to. So
Yeah.
and we're not done yet. There's gaps in the map that keep me awake at night to go find chiropractors. I've told you I'm going to Australia, going to UK, and going to train. So there's a set of technology, and we'll send this link too for the show notes, the 𝐖𝐡𝐚𝐭 scans. So these are subluxation nervous system dysregulation tests. And so the 3-check process I would send parents to, the first 2 you can do on your own. And if you check yes on the first 2, you do the third. Please, my heart, my soul, my prayer for you, do the third. So if your case history of your child has some or all, especially of those things we talked about with the perfect storm, and then if there was colic, constipation, but especially if there's sensory motor, gross motor, developmental delays, and just physically, guys, it. You can see your kiddo. The younger ones become really, really wound up. They're just physically tense, right, Roseann? You know what that
Yeah.
becomes, though, when they hit grade school and teens, is they become exhausted.
Yeah.
Their posture, they're depleted. So you can
Yeah.
see
They
the
start
physical
looking
stuff.
ADD.
They
They start
do.
getting,
They're
they fall into other things.
shut down.
They shut down. And,
So
I
those
think
scans, getting from that, if you see those things, get into a PX doc's office, have the consultation, you'll never meet a doctor who sits down and goes into it with detail. And then these 𝐖𝐡𝐚𝐭 scans will change your life, because you'll be able to know for
see.
sure my
Yeah.
child is here.
It's so amazing to see. I also want to say this about chiropractics and even just my own personal experience, right? It's sort of like, the world of neurofeedback. People think like, what is it? What is it like? Is my kid going to
Yeah.
mind it? Neurofeedback. We've only ever had one kid refuse it. But chiropractics is gentle.
Oh, they love
The
it.
kids like
Love
going. Like I have lots of kids. Like I have parents who are like, I mean, the chiropractics help so
Thank you.
much, and, should I stop? And I'm like, "Does your kid mind going? Like, just go on a maintenance, like, talk to your
Yep.
chiropractor, maybe it's twice a month or whatever."
Yep.
But, it is a really pleasant process. I really
Thank you.
rarely have ever seen anybody I can think of maybe 1 or 2 people
Yeah.
where I thought they got overstimulated.
Right.
Again, I didn't think it was the right format for them,
That's
and then
yeah.
sent them to somebody else.
Yeah, I
It
love
was
it.
more of like, I like kids, but I'm really an adult,
It's it it
chiropractor
it well,
who
it
can
happens
figure
it
you
happens
out.
more than I wish it did. Yeah, for
Yeah.
sure. Yeah.
But so I just want to say that because parents are always like, oh, what do I say? What do I do? Just a
Well,
pleasant
especially 'cause
process.
your kids have been to doctors who have been poked and prodded, and they don't, so you might
Yeah.
kind of throw the baby. Oh, that is genius to say that, Roseann, because a lot of times, totally understandable, you throw the baby out in the bathwater. You're like, well, that's
Yeah.
physical. You got to put your hands. My kid's not going to do it. You should see. I wish you could just be on my hip all day. And anybody who wants to come shadow and become a chiropractor, we need thousands more of you. So go ahead, let's go.
Yeah.
Let's change the kid's
Yeah.
life.
Share this with your chiropractor because
I've
they
had
train the PX
91.
docs trains.
I've had 91 of my patients in 16 years, 17 years now of practice go on to become chiropractors because it's so
Oh,
revolutionary.
isn't that
It's the coolest thing ever.
amazing?
And, but these kids will come in, and yes, the first visit or 2, we are just trained. There's no script for this. God made all of us who do this work to do this work. Like
Yes.
they trust us. Everybody who works in my office, every assistant, every tech, everybody, they're perfect storm moms. They've had their life. I literally haven't placed a freaking LinkedIn or job wanted ad in 15 years. So we're all made for this. You come into the office, and PX Docs offices are like this. It's so calming. We literally choose our layout. We choose our paint. We choose our style. We choose our people to be there for your kiddo, to regulate their, like the healing. It may sound corny, but not for your audience. The healing literally freaking begins to happen in the parking lot. Like all of this is by design. And so after just one or two adjustments, the funniest thing, and it really cements this, is because you can't overstimulate. You actually don't, like when parents watch their kids get adjusted the first times, they're like, that's it. I was so worked up over this. It's like the gentlest, easiest thing. And even kids, especially the more locked in they are, sometimes they'll be this more, they like get mad that we don't adjust more. It feels so good.
Definitely.
They're like, give me more.
Yeah.
The meltdowns happen when they have to leave the office. It's so freaking funny because they're like,
because they feel good.
Yeah,
and they want to replicate that. You said so many important things. I'm gonna, summarize this episode after we conclude. But it is really, truly remarkable that nobody's talking more about birth trauma, how it's not what you think, and really how it can impact a child and either lead to or look like neurodivergent conditions, because that's another controversy. I mean, I've seen kids get, comprehensive interventions, multi-pronged approach, and neither one of us are saying chiropractic is the only thing.
No.
Neurofeedback's the only thing. PMS the only thing. What we're saying is that this can be something that is a game changer. And, if birth trauma is a part of this, you do have to realign that neck, the neck, the back, your whole body in order for everything else to work. And there's no harm in getting an assessment. It's always a good idea. It's a piece to the puzzle. And I love that your people are finding you before they're reaching for medication. And that's the beauty of doing all of this, is we have so many smart parents, mostly mothers. Moms are the quarterbacks.
I literally look around at my team all the time, and I just say it to myself all the time. And you can probably imagine with my Raging Bull ADHD, well-adjusted, finely tuned brain, there's a lot of conversations happening up there, not just the one that's coming out loud. Yeah, totally. Right. And I look around and I go, oh my God. And I literally mean that. I am my connection to, like, I am called to this and brought to this by God. He saved and transformed my son's life. I was already doing this work. And then Oliver, and you can find that on our website, Oliver's story was the catalyst. But I literally say in my prayers, I'm like, this is working. This is happening. These parents, they knew all along, but they just needed people to tell them the truth and confirm to them what you already knew deep down inside your gut.
True.
You were right.
So true, Dr. Tony. Yeah, it's true. I mean, and, so many parents come to us at every age, because I focus on mental health. I mean, I do get very young kids. 4 years old is kind of a very common time for me to see people, but I get a lot of young adults who've just spent an entire lifetime, as I always say, kind of duct taping this, like this sort of worked, that sort of worked, that sort of worked. And then, they're trying to launch and then it all falls apart, right? Because they don't have that same duct tape around them, and that's why I love talking about root causes.
That was my story. I mean, just real quick and short, I had a traumatic birth. I thankfully grew up in a farm family, which doesn't mean we were healthy. I mean, it was not, but we also means we didn't go, farmers just believe, well, they're too busy to go to the doctor. Okay. So we didn't get like medicated to do all this. And I was outside, but I was sensory. So growing up, like literally, if you Google farmer, Steve Ebel pops up, leather skin, and he breaks your hand with a handshake, like actual farmer. Right now, I'm a total fake farmer. I am a fake Instagram farmer. Okay. I, like most people, wear Carhartt and they shouldn't. Okay. But I real farm. And so because I was outside and because I was active, my ADHD just stayed above the board. But sensory kid, I was supposed to wear steel-toed work boots and jeans and cotton thick t-shirts from the Luther Church hand-me-down, right, to school. Guess what I wanted to wear, Roseann? Adidas track pants. My dad used to call them rubber pants. Yeah. And so I chewed on every pen to just try. And I sucked at school, like the actual turning things in. So many parents are going to relate right now that you have a Tony. Okay. And I want you to know, I hate talking about myself, but God has this massive plan for your child when their nervous system becomes regulated. And so I never turned things in on time. I didn't pay attention, but Raging Bull brain, I could take standardized tests. I could take the ACT right now and smoke that sucker. Right. We were talking about those downloads. And I got away with it. much to the chagrin of everybody else in my life, right? Until, and you'll love, I say love this because you'll just get this better than anybody else on earth. So farm family, farmers mean everything to you. When I was a junior in college, classes were getting harder. My lifestyle was terrible. I had no chiropractic. I had never said the damn word chiropractic, nervous system regulation, vagus nerve in my life to that point. And my uncle dies on a farming accident on our farm next to my father, who was my best friend and my whole life. And I've never seen my dad shed a tear, right? Farm dude. And so my dad understandably falls apart. So I fall apart. So all of my sensory ADHD, nervous system dysregulation issues that I wasn't even aware I had, and I had been functioning fine, school and social and everything else, my life crumbled. And God is just the most amazing miracle traffic director ever. That is actually when I found chiropractic for shoulder pain, regular stuff, shoulder pain, sports injury, everything else. And I go to Dr. Albert and I go into chiropractic and I find out about it. And after my first adjustment, like I'm a kid who never could fall asleep, stay asleep. Like I remember not sleeping for 20 years of my life. That's what I remember, right? So how are you going to focus and regulate after that?
Of course.
I slept for 14 hours straight.
You had a reset. You had a nervous.
So now I'm missing class because I am actually sleeping instead of, so it was the most transformative. So if you're listening for your own nervous system, for your young adult's nervous system, for your teenager's nervous system, and we talked about birth and we talked about trauma, you're good. Healing freaking happens here. Nervous systems are designed by God to heal. It's amazing how far everybody can go with nervous system healing.
Yeah. And you just got to take action and you got to be consistent. Don't be saying I'm going to do it one time and it didn't work. That's the thing. And, some of us have experiences. My first, time I did neurofeedback, I was like, holy crap, when can I get my equipment? Like it was a miracle. That doesn't always happen. Sometimes your nervous system is under or overstimulated, needs some time.
Layers.
And you have to chip away. So just be vigilant and keep the hope, So this has just been such an impactful conversation. I can't wait for this to launch and for people to hear this and, to be continued because.
And you're coming on ours. You're coming on the Experience Miracles podcast, baby. So get ready to roll.
Yes. Yeah. But I know you brought a lot of hope to people and this was a really encouraging, it's serious topic about brain, having potential of having some level of birth trauma, but I hope people really see the clear path and thank you. And I look forward for you being on again.
Yeah, I love you. Thank you. Everybody listening, you have everything you need to just get to the other side of that storm. And so often it's just the right doctors, the right people to join up on your team, get that plan built out. Dr. Roseann, I love you. I respect the heck out of you. I'm so grateful for you. And everybody listening, thanks for giving me your time today. I really, really cherish it.
Well, thank you.